Are you looking for all-on-4 dental implants? Are you confused whether you are a right candidate to receive all-on-4 dental implants or not? Then this is a video for you. My friends, I, Dr. Mayur Khairnar, Director of PreciGem Dental World, your full mouth implant specialist with an experience of placement of more than 15,000 dental implants and treatment of more than thousands of full mouth implants patients, experience of which you can see on our YouTube channel Dr. Mayur Khairnar. In this video, I'm going to present total insight about all-on-4 dental implants. Yes, my friends, in this video, I'm going to reveal all the secrets related to all-on-4 dental implants. So, if you're not subscribed to our channel, then definitely subscribe our channel by pressing the bell icon so that you'll be notified about our future videos. So, before I start, let me tell you, I'm going to focus on this video about 6 different topics. The first one would be type of available bone which you have when all teeth are lost or all the teeth are compromised. So I'm going to talk about in detail about available bone types. I'm going to talk about what is cantilever and how does it affects the success of all-on-4 dental implants. I'm going to talk in detail about pro and cons about all-on-4 dental implants. I will also compare all-on-4 implants with all-on-6, all-on-8 and the new modified version which is called all-on basal cortical concept. So also most importantly, I'm going to cover on pterygoid implants and inclined corticomandibular implants, and least not less, I'm going to focus also on the price of all-on-4 dental implants at the end of this video. So my friends, stay connected with me till the end of this video, because at the end of the video I'm going to reveal what is the price of the all-on-4 implants and how this can be beneficial and how you can plan to achieve the all-on-4 dental implants. So let me start with type of available bone. Now, as the name suggests, abundant bone, that means an individual is having a lot of bone in the upper jaw and in the lower jaw. Now let me show you, you can see next to me is an x-ray. Now let me show you a diagrammatic representation of this x-ray above. So this is nothing but a maxilla, upper jaw. Then we have something called lower jaw. In the maxilla we have sinus cavity. Above the nose, inside the nose, we have a nasal cavity, right? So if there is a good bone height available below the sinus cavity and below the nasal cavity, that is considered as abundant bone in the upper jaw. Same way, in the lower jaw we have something called inferior alveolar nerve. Above inferior alveolar nerve, if the bone is good in height, then we can consider as a good abundant bone in the lower jaw as well. So that is a case of abundant jawbone. Let's come to the moderately resorbed jawbone. Now this happens because of the dentures. Now you're been wearing a denture for a long amount of time, or basically because of the periodontally compromised dentition, you have left it untreated for a long time, then definitely bone will resorb. So if you want to know more detail about it, press the I button above and you will get that video. So in this moderate resorb bone, usually the sinus is expanded and at the expense the bone is lost. So there is very less height available below the sinus, but there is a good height, decent height available below the nasal cavity in this region. Same way in the lower jaw, above the nerve, there is a limited jawbone height available, maybe around 8 millimeters or 10 millimeters or maybe less than that. So that's a moderate resorb bone cases. Now let me tell you what is severely resorb bone cases. Now this is a situation, typically you can see the x-ray over here. This is a situation of patient is wearing denture for 15 years, and because of the dentures, as I've told you, you can see my last videos where dentures, the patient bone get totally resorbed and worn off. So this is situations where there is a poor height of bone available below the nasal cavity and as well as below the sinus cavity. And of course the bone is so much resorbed that it has come close to the position of the nerve, so which you can see in the x-ray. So this is severely resorbed cases. 99.9% of the dental surgeons usually don't go ahead with dental implants procedure in these situations, but we do. So stay connected with us. I'm going to give you options if you have such kind of a bone as well. So coming to the second point, what is cantilever? Now it is very important for you to understand the concept of cantilever if you're planning of getting all-on-4 dental implants. So before going ahead with the cantilever concept, let me divide the full mouth teeth into 4 segments, that is upper right, upper left, lower right and lower left. So you can see the numbering which is given to the teeth. So central incisors is 1, 1, and then we go gradually outsides towards till the end is 8, that is the third molar. So this is basically a tooth numbering system. So I'm going to use this particular system when I'm addressing with the next slides. So suppose we are coming across the situations which is replacing three missing teeth. So I get a lot of queries where patient asks me, I want to replace three missing teeth and can it be done with a one implant? So I say clearly no. Why? I will tell you the reason. Now if one implant is placed to replace three missing teeth and the forces which is happening, the segment which is unsupported on the opposite side is nothing but a cantilever. Cantilever is nothing but an unsupported area. So there is no support, so there is chances this can fracture or implants can come into a problem. So we never wanted to invite a problem. So the proper treatment planning is very mandatory. So how it can be corrected is simply by placing two implants and replacing three teeth. So this is a very good planning where we minimize the forces coming on the implants. Now let's take a scenario where we are replacing six missing teeth. That is the half of the jaw. So in this scenario, if suppose we just place two implants, so definitely the forces which is coming on unsupported segment, that is cantilever segments, will be high and there is a chance it can fracture or implants come into a problem. So if suppose we wanted to avoid the cantilever segment and we place implants on the extreme end, but still this could be a problem because at the center the forces will be high and it would be, we can call this as a kind of a suspended cantilever, and here even the fractures can or a problem can happen. So what is the best treatment for replacement of such kind of a scenario? So best would be to place either 4 or 3 minimum implants in a proper position and replace the teeth with a proper equilibrium. Now let's compare all on 4 with all on 6, all on 8 and all on basal cortical concept. So you'll get a more clear idea about this. So guys, you're very well aware about what is abundant bone. Now initially long back when the bone used to be good, even today many doctors place 8 implants, they wait and then they give teeth to the patient after 2 to 3 months. But this is a rare scenario where we get such good amount of bone till the second molar or third molars, everywhere the bone is abundant. So when little sinus is expanded in the region of the 7 or 8, that is in your second molar and third molar, there the option was left out was placement of 6 implants, and on the 6 implants the dentist used to give you 12 teeth and there was no cantilever. So you can see in this situation there is absolutely no cantilever, so that's an advantage. In abundant bone, if you are going ahead with all on 6 straight implants, there is no cantilever, so cantilever can be avoided. That's one of the advantage of all on 6. Now this is a case of abundant bone. Now problem used to happen when it used to be a moderate bone cases, because moderate bone cases, because of the resorption or because of the sinus expansion, the area of the bone below the sinus was very less. Same way the height of the bone above the nerve was very less. So this is a challenging area. As I've told you, I've demarcated this 4 circles was a major challenge area for managing all on 6 with straight implants. So what was options given that time was placement of 4 implants and 4 implants in the upper and lower jaw in the front region where the bone was good, but in the back region where the sinus is expanded, it was suggested to go ahead with a sinus lift procedure. So sinus lift is nothing but, you can see above me, the membrane has been lifted, the sinus membrane, the bone graft is pushed into it, then you have to wait for a certain period of time and then you place the implants like this. After the placement of implants, you have to wait for a long period of time. Similarly, in the lower jaw, the height was less enough, so the height of the bone was also raised with the help of bone grafting procedures. So this is not technically very successful though, but still a lot of dentists or doctors used to do that and then they used to place the implants. This was the total long lasting procedures, lot of surgical appointments was there, a lot of pain, then a lot of swelling, and again a lot of consideration to be taken for diet, everything. You are not supposed to be smoker because it will fail. Lot of problems used to be there and patient used to be in the just mental trauma for 4 to 6 months. So this was little obsolete after certain period of time, and what was decided to, let's try the full mouth with 4 implants. Now how it was planned, now as you saw, after 6 months period of time, then they used to give a teeth. But what was the plan? So the plan was just to eliminate these 4 implants on the back side and place only 4 implants in upper jaw in the front and the 4 implants in the lower jaw. That was the origin of all on 4 concept. But if we place 4 implants straight into the upper arch, into the front region as well as in the lower region, the cantilever which is going to be there, which you can see with the red line arrow marks, it's going to be very, very high. So what was thought, so if you can see, I can give you a brief explanation. So see here, the two teeth are unsupported on each side because we have placed straight implants. So what was decided, let's place the distal implants, or I would say let's place the rear implants with a little tilt. So all on four, they decided to tilt the implant. So by tilting the implants, they reduced a cantilever segment. So if you saw this, initially it was two segment, now it is just because of tilting, the cantilever segment is reduced to just one tooth. That is the concept of all on four implants. So if you can see, the above slide is nothing but a traditional way the four implants are placed, just like all on six, but that's not possible because there's cantilever is very high, whereas here they have tilted the rear implants or the back implants with a particular tilt of maybe 30-45 degree, something like that, and then they reduce the segment by one tooth. So basically this is all on four concept for a moderate resorb bone case, but definitely there is going to be cantilever. Now the question is, how much cantilever and how many teeth cantilever? Is cantilever possible in every situations, or can we avoid cantilever? It totally depends on your anatomy. It means your position of the sinus and your position of your nerve with respect to the bone. So that's a situation. If you can see here well, the sinus is expanded to the tooth number 6. Now tooth number 6 is nothing but your first molar. So the first molar, there is a bone which is available, but beyond that there is no bone available. Same way here, the mental foramen is nothing but your inferior alveolar nerve comes out of your lower jaw. There is some hole, and that hole is nothing but, you can see, is as a red mark, and that is nothing but a mental foramen. So your nerve comes out of it. So how it was done in this situation, all on four is also done, but if you can see, because it is expanded till the 6th, that is first molar, the implants is placed in the region of the first molars, and that's where we have totally avoided all the cantilevers. Now this is a very rare situation where we get sinus expanded till 6th region, or mental foramen till the 6th region, which is a rare of a rare situations. And so here the cantilever is close to minimum or not at all. But a very rare situation. Most common situations which we come across is a sinus which gets expanded till 5. That means the bone is available only in the region of second premolar. So what is planned is placement of implants tilted in the region of the 5, which you can see over next to me, and one tooth cantilever, which you can see above me, the calculations. So here in that situation, still you are getting one tooth cantilever. So this is the most common situation. If the bone is still more compromised and it is expanded till the 4, then probably you will still in a situation to place 4 implants. But now the cantilever is not one tooth. You're going to have a 2 teeth which is cantilever, which you can see above me. And again, cantilevers actually are not really great. The best solution for a long lasting is to avoid cantilever if possible. So I'm going to tell you at the end of this video how we can avoid cantilever in each and every situations. And when the sinus is expanded till the region of the 3, but there is a bone available below the nasal cavity. Okay, so here if we go at just placement of 4 implants straight, because tilting is not really easy, the option number 1 is this. We just place straight 4 implants the way I've showed you in the previous slides. So and give a 3 teeth cantilever. Definitely this is going to be creating a huge problem to a patient. So this is not at all advisable. The second option being, instead of giving a 3 teeth cantilever, reduce the segment and go ahead and place straight 4 implants and reduce the segment to 2 teeth cantilever. So only 2 teeth will be there. So number of teeth with the patient will be having will be still more less, and this is definitely going to compromise on chewing. Definitely. So still this is not a really great option, which I will never do. But what I would suggest is to go ahead with the placement of 2 implants in the nasal cavity and go ahead with a zygomatic implant. Zygoma bone is nothing but your cheekbone, so that even in the resorption, most resorb cases, you can achieve at least receive 1 teeth cantilever. Well, I do something in this situation where I can avoid all the cantilevers. So what is that? And that is nothing but all on basal cortical concept. So I'm going to compare this concept with all on 4 at the end of this video. You'll get a total insight about it. So if you see, the sinus is expanded till 3, still we are in a situation to give a good 6 to 6, that is 12 teeth occlusion and cantilever, but one tooth. Well, the scenario when the height is very bad, below the nasal cavity as below the sinus cavity, and total vertical bone loss, in that scenario definitely we have no option left out other than 4 zygomatic implants, and still we will be in a situation to give one tooth cantilever if you are going with the all on 4 concept. I hope you got this concept. Now I will tell you about what is all on basal cortical. It is nothing but a modified all on 6 concept where there is absolutely no cantilever, zero cantilever, and it's an immediate loading concept. Of course, that means patients receive teeth in just 3 to 5 days period of time. It's a modified version of an all on 4 or all on 6 or all on 8. So as you very well know, this is upper and lower jaw moderately resorbed bone case. If you see in each and every diagram which I have presented in all on 4 cases, you might have noticed these 4 circles. This area is never touched. My friends, these are the areas where the bone is always available, but it has to be searched. A good clinician or a good dentist or a good surgeon would definitely utilize this bone, because there the muscles are attached very well and you can achieve a great amount of stability. So what is the plan? Going ahead with the 4 all on 4 implants in upper and lower. Then in order to reduce this cantilever, we have to place another implant, but at the back or the rear of the sinus. So where exactly? Into the pterygoid complex. So placing a pterygoid implants is mandatory, and placing an inclined corticomandible implants. So if you can see image very next to me, the height is just 6 to 8 millimeters, but by tilting the implants like this, we could be in a situation to place even an implant of 10 to 12 millimeters, and that's technically proven. Tilted implants work good. So by placing an inclined corticomandible implant and pterygoid implants, we can easily avoid any type of cantilevers in any type of resorbed bone cases. So that's the concept of, I believe in giving no cantilever to the patients at all. So let's check this scenario. Now here the sinus expanded till 3, which you can see. Okay, so here that's the bone level. The implants are placed plant like this, and implants are placed, and if you can see, that's how even in this scenario we avoided zygomatic implants and we placed implants into the pterygoid complex and in fact behind the ventral foramen in the lower jaw, and we avoided technically all the cantilever to the lower jaw and upper jaw. So cantilever can be easily avoided if it is well planned and all the good bones is utilized. So my friends, just compare a regular case of all on 4 with all on basal cortical in the above case. Well, you can see the difference. Pterygoid implants are utilized and we can easily avoid the cantilever. You can see an above, upper and lower both. In above all on 4 and ABC, both the x-rays as well as the images. Same way, so let me show you one case where this patient came to us from UK, and he said that he has received this all on 4, which is absolutely was not in a proper alignment. Now there was definitely or a sinus expansion in upper and lower jaw. Now what was planned? We decided we will go ahead with a full mouth definitely, but we need to reinforce your upper and lower jaw. So what was decided? To go ahead with the placements of few implants in such a way that proper forces will be distributed on all the implants everywhere. So that's what done. We placed pterygoid implants. We placed one implant which was in the upper left premolar region tilted, that is bypassing the sinus, and in the lower jaw the normal way, and then we loaded this process to the patient. Now this is a happy patient. So a proper plan, if it is done, we can easily avoid a cantilever segments to the patient. Same way, let's see one of the case above me. This is one of the patient which visited us for changing the teeth. Now here there is so much of bone available up on the above x-ray that is done with the all on 4 in the pterygoid zone, and still the patient is having 2 teeth cantilever in upper and lower jaw both. So if you can imagine, we can easily avoid cantilever. The one of the major disadvantage of all on 4 implants is if one implant comes into compromise, okay, one implant comes compromised or one implant get rejected by the bone, then probably whole segment is wasted, whole teeth is wasted. Whereas in all on basal cortical, if suppose one of the implants is rejected by the bone, you can just simply remove the implants and give the same teeth to the patient back again. So your loss is minimum in this kind of a scenario. So that's why I always recommend avoid cantilever and go ahead with, instead of 4 implants, go ahead with more number of implants, because by utilizing the most available best suitable bone in the lower jaw and in the upper jaw, that is pterygoid bone, and in the lingual cortical in the lower jaw. So let's see this again, a case above, which is totally resorbed bone, which is done with all on basal cortical and all on 4. So all on 4, you can see the pterygoids is untouched. There is really good bone of pterygoid and we can easily avoid cantilever. Whereas in the lower x-ray, you can see even if we place 4 quad zygoma, but we approach pterygoids and we were in a situation to give patient a firm teeth prosthesis, and even the same way the lower was also done. So let's coming to what is cost of all on 4, all on 6 and all on basal cortical implant concept. So cost of one particular arch, if it is done with any of this concept, ranges between $3,000 to $6,000 anywhere. It all depends on type of teeth which is selected, the prosthesis, the weight of the prosthesis, and many more factors, the bone resorption, what kind of complex bone it is, so many more things. I will tell you one thing, all on 4 and all on 6 doesn't cost so much into that. So never compromise on getting 6 implants if it is possible. There are certain scenarios where pterygoids is not at all available, then definitely, yeah, okay, you can go ahead with all on 4, but whenever it is possible, go ahead with the 6 implants. All on basal cortical is one of the best concepts where you can achieve the advantage of all on 6, that is no cantilever, and advantage of all on 4, that is immediate loading, both the way. And the cost for ABC and all on 4 is almost same, in spite of that you getting more number of implants, that's 2 implants, it's the same. So don't worry about that. It will range between $3,000 to $6,000 per arch. If it is a full mouth, that is upper and lower, then it will range between $6,000 to $12,000. What we want you to send us is a dental CBCT scans, your OPG x-rays, all your teeth pictures which you can see. Kindly send us pictures like this, which you can see above. So this kind of a pictures will really help us to get a real idea about what is your dental situation. Even if you're staying far apart, no problem. At the same time, my team, you can contact us on our helpline number or through our email. My team will help you to get you on a call and they will explain you in detail about all the further process. We can also have something called video consultations, and my team will definitely help you to get more and more insight about it. So if you like this video, please do not forget to share this video with those who needs all on 4 or all on 6 implants, and definitely do subscribe and share our channel. So let's stay connected with us. Again, see you soon on our next videos. Till then, Jai Hind, Jai Bharat. Thank you so much.